Mr. President.
Senator from Washington.
Mr. President, I ask the quorum call be dispensed with.
Without objection.
Mr. President, I come to the floor to talk about the President's proposed budget as it relates to Medicaid and the fact that it is just a war on Medicaid. That is, that it continues the wrong-headed ideas that have been proposed in the House bill on health care reform and takes that and continues to make cuts to Medicaid that are unsustainable for our health care system. The President's budget would impose a block grant per capita cap on states in 2020 in so-called exchange for flexibility. I haven't met one state or administrative of health care in our state that says they need more flexibility. They all have had a lot of luck with flexibility in Medicaid, but they know this is just a budget cap and a budget cut. The budget would result in a $610 billion cuts to state, in addition to what would happen if they were successful in passing the House bill here in the Senate. The Center on Budget and Priority Policies put the Trump budget cuts to Medicaid, quote, considerably more deeply than the House bill because of what per capita would do. So no doubt what the budget is proposing from the President today and what our House colleagues have proposed on health care means more damage for health care and more damage for Medicaid. But let's be more specific. Medicaid for health care is about children, it's about seniors, it's about disabled, it's about working families, it's about young people. Medicaid covers half the births and the majority of long-term care stays. What people may not realize is the President's budget cut to Medicaid also cuts children's health care, as a new study reveals today, by $43 billion. That's taking health care away from children, poor children, who need access to health care. It additionally impacts 1.75 million veterans who also get health care through Medicaid. So how can we possibly be standing here with a budget proposal by the President of the United States after he promised not to cut Medicaid, that not only proposes to cut Medicaid, but cuts children's and veterans' health care when they need it most? Medicaid is a lifeline for people who can't get covered or can't get a fair deal. It is a highly cost-effective, dynamic, and innovative structure that has worked well. And Medicaid is winning in the economic strategies for how to help lift families out of poverty. It's one of the most successful anti-poverty programs in the United States and the second largest program to combat extreme poverty. Its expansion in Washington has helped create jobs indirectly and directly and has saved our state about $353 million in our state budget. It injects billions into the economy and supports our high-wage, high-sector jobs throughout the healthcare economy. But as we know, our colleagues in the House Draconian Health Care Act would for the first time cut Medicaid's successful program by introducing a cap that would result in reductions every year to the Medicaid program. Regardless of who needed access, regardless of those children, regardless of those veterans, it would just continue to push down on the Medicaid. I've said to my colleagues in the House, there's far more innovative ways to help our healthcare delivery system that are cost-effective. But simply cutting veterans or families or children off of Medicaid is not the way to do it. The President's budget released today would reinforce this permanent cap. Currently, Medicaid is a needs-based partnership between the state and federal government, and during economic recessions and natural disasters and public health emergencies, states know they can count on the federal government. But under what's been proposed in the House, the per capita cap would give states only a fixed amount and start reducing the amount of money tied to health care. It would leave a tsunami of seniors and others without new technologies, prescription drugs, or access to address new healthcare threats. So there is nothing about it that is a reform proposal. It is not innovation. It is simply a budget mechanism to cut Medicaid. I don't know how the president, given that he promised before not to cut Medicaid, he, quote, said, "I'm the first and only potential GOP candidate to say there will be no cuts to Social Security, Medicare, or Medicaid." So if that's what the president tweeted, if that's what he said he was going to do, then why now is he proposing a budget that actually cuts Medicaid? So we do not want to throw off, in my state, 14 million Medicare beneficiaries off of coverage. I'm sorry, 600,000 in my state, and 14 million across the country, and take 1.4 million out of Washington State's economy every year. These are numbers according to the Congressional Budget Office about the most recent estimates of what this would do. So, Mr. President, I think it's time to say no to the president's budget proposal. It's time to remind the president of his promise not to cut Medicaid. And it's time to stop talking about the silly idea of capping Medicaid and reducing funding to the states. I mentioned the impact on children and veterans. I also want to mention the impact on those suffering from the opioid epidemic and what we have been trying to do to treat those individuals. Also, those facilities would be in great danger of continuing to treat that population if they don't have Medicaid. So the notion that this is a smart healthcare strategy or a smart healthcare budget, it's not. It is a draconian measure that is going to leave many, many more Americans without healthcare. As I said, Medicaid is a successful program. The promise should be kept, and we should continue to improve the delivery system as a way to make it more cost-effective. I know we can't afford to leave sick children without access to health care, and now is not the time to leave veterans without the health care they deserve. I thank the President, and I yield the floor.